Hi and welcome back to another video of Medic Notes. This video is on ultrasound in obstetrics. For introduction, ultrasound is now a standard tool in any pregnancy. 2 ultrasound scans are considered the minimum standard for low-risk antenatal patients. First one should be dating scan. Second should be performed sometime in the 3rd trimester as a screening for fetal growth, placental localization, and liquor assessment. There are a few types of scans in obstetrics. First one is the dating scan. All pregnant mothers should have an early dating ultrasound. The indications are unsure of dates, having irregular menses, on hormonal contraception up to 3 months before pregnancy, and amenorrheic since last childbirth. I have another video explaining in more details for dating scan, which I will include in the end of this video. The next scan is the 1st trimester screening scan. This is performed between 11 weeks to 13 weeks 6 days. It is used mainly to quantify the risk of trisomy 13, 18, and 21. Preeclampsia risk assessment can be performed in same setting. It is possible to diagnose major fetal anomalies like anencephaly and holoprosencephaly. Next scan is mid-trimester screening scan, or also called detailed scan. This scan is performed by MFM specialist at 18 to 24 weeks. The special indications are mothers age more than 40 years old, pre-existing diabetes, inclusive of MOGTT more than 7 and 11 mmol, L first diagnosed in pregnancy. Personal or family history of fetal or chromosomal anomaly. Congenital heart disease or previous offspring with congenital heart disease. On anti-epileptic drugs or exposure to other potentially teratogenic medications, chemicals or radiation. High-risk woman determined during 1st trimester screening, and maternal anxiety. Another scan is the anomaly scan, performed by MFM specialist at any gestation for suspected fetal anomaly. Growth scan is performed usually after 24 weeks, except for monochorionic twins, which should be from 16 weeks onwards. For high-risk women, serial scans may be indicated 2 to 4 weekly. Assessment should include fetal biometry and liquor volume. Umbilical artery Doppler may be indicated in high-risk women. Umbilical artery Doppler scan is usually performed as a part of monitoring in high-risk women. In SGA or suspected IUGR fetuses. And in twin pregnancies with discordant growth or discordant liquor volume. Middle cerebral artery Doppler. MCA pulsatility index is done to diagnose or monitor IUGR. MCA peak systolic velocity is used to diagnose fetal anemia or fetal polysemia. Let's look at the suggested ultrasound schedule for singleton and multiple pregnancies. First for singleton fetus. First scan done at booking visit. To confirm pregnancy, to rule out ectopic pregnancy, to establish viability of fetus, to rule out multiple pregnancy, and for dating scan. A detailed scan is done at 18 to 24 weeks only if indicated. For low-risk pregnancy, next scan around 28 to 32 weeks to assess growth and liquor volume, and determine placenta location. Whereas in high-risk pregnancies, do serial growth scans 2 to 4 weekly from 24 weeks gestation onwards. Plus-minus umbilical artery PI. Determine placenta location at 28 to 32 weeks. Confirm lie and presentation at around 36 weeks. Next, we look at the suggested ultrasound schedule for multiple pregnancies. Upon diagnosis of twins during booking, verify the date by following the date of bigger twin. Determine chorionicity and amnionicity before 16 weeks. A detail scan is done at 18 to 24 weeks if indicated. Growth scan schedule is different for DCDA twin and monochorionic twins. For DCDA twins, serial growth scan is done from 24 weeks onwards. 4 weekly if no other risk factors, 2 weekly if there is risk factors. The main focus is to detect discordant growth or liquor, and to detect IUGR or selective IUGR. DCDA twins usually delivered at 37 to 38 weeks. Whereas for monochorionic twins, serial growth scan is indicated starting from 16 weeks onwards. Between 16 to 24 weeks, 2 weekly scans to detect severe early onset TTTS. For 24 weeks onwards, every 2 weeks, preferably with MCA Doppler to detect TAPS, twin anemia polysemia sequence, which is a complication of twin-twin transfusion syndrome. MCMA usually delivered at 34 weeks, MCDA usually delivered at 36 weeks. That's all for this video. Thank you.